Hello, I'm Michelle Crum, a Regional Risk Manager with ProAssurance. Locum Tenens providers play an integral role in our healthcare system. They help ensure continuity in the delivery of care when providers are absent or on leave, but there are unique billing, coverage, and risk management issues that accompany utilization of these professionals. Billing for locum tenens varies by payer, but typically adheres to CMS guidelines. Before billing, verify with individual payers whether they follow these guidelines or have different rules for locum reimbursement. Most payers allow billing under the regular physician's name and NPI, although some require credentialing locum physicians first and billing under their name. If the payer handles credentialing, the process may be expedited. Medicare allows locum tenens physicians to bill under another physician's NPI using the HCPCS modifier Q6 for temporary situations lasting no more than 60 days. After this period, substituting physicians will bill under their own NPI. This arrangement is permissible only for physicians and physical therapists, not for non-physician practitioners such as nurse practitioners or physician's assistants. If a practice requires locum services beyond 60 days, it must enroll the locum physician in the payer mix before the period ends. It is also important to note that practices cannot circumvent this rule by rotating different locum physicians within the 60-day limit. When it comes to medical professional liability coverage, most policies cover locum tenens for 60 days. Special exceptions exist when a physician or physical therapist is called into active duty in the armed forces. It is generally best practice to notify your malpractice carrier of the locum arrangement to ensure that malpractice coverage applies for the physician services provided by the locum provider. From a risk management perspective, there are several ways to mitigate risk when utilizing a locum tenens. First, ensure that the locum tenens is properly qualified and is of the same specialty as the absentee physician. Second, develop a checklist that outlines critical policies and practices specific to your healthcare organization. Locum tenens are tasked with managing patient care, utilizing shared office space and staff, billing for services, maintaining timely documentation, and ensuring coordinated care. Easy-to-decipher checklists can provide crucial guidance. Finally, ensure that your organization has established policies covering the onboarding, supervision, and departure of locum tenens physicians and practitioners.